So I had a video recently saying that if a patient is super mean to you or your colleagues, treat them like they're 4. And I stand by that, but there are caveats. There's nuance to this. If they have dementia and they are sundowning, probably not going to work. If they are literally 4 and they're upset and saying mean things because they have appendicitis or they're getting worked up and they need a blood stick, probably not going to work for them either. Or if they have a developmental delay or a cognitive disability, probably not going to work. For those folks, there's a commonality between them, and it's what do they like and who do they like. It's a unique challenge when you need to put a central line in an 11-year-old with Down syndrome, nonverbal, autism, things like that, right? To say, hey, I'm going to lay you down and I'm going to put a needle in your neck. Probably not going to go very well, right? But if you're able to understand that the patient really likes the Weather Channel and their mom, and you're able to incorporate that into your procedure, it's probably going to go much better, right? Your 95-year-old dude bro guy who was a World War II vet and worked on cars and really likes jazz and all of this, like, incorporate it. It's not very hard, right? And sometimes that doesn't go perfectly, obviously. But if you go into an interaction with a patient with that level of effort, you are usually rewarded with that. Take a Peds patient or a young adult with a cognitive delay, and they need a laceration repair, and you need to put a splint on, and it's uncomfortable, right? And if they don't fully understand what you're trying to do, the family does. And if they know you're trying to make it as comfortable as possible for that patient, let's set up the environment. Let's dim the lights. Let's get some music going. They like white noise. They want to wear their headphones. I don't care. You know what I mean? I often tell med students or residents, at minimum, the family and the patient really know you care. Even if they don't, that's good for patient care, to go with that mentality. Yeah, of course there's nuance to the agitated patient, the difficult patient, whatever you define that as, but I'm often surprised how little effort needs to go in to get a very good result, even in the toughest of patients.